Why nurse practitioners are a popular and emerging force in the healthcare field. What is a nurse practitioner? Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical right here in Amarillo, Texas. And I want to talk to you today about nurse practitioners. We hired a nurse practitioner when we integrated with medical services here in 2021. But some folks don't even know what a nurse practitioner is or why they would want to see one. I'm here to clear it all up. More and more these days, nurse practitioners, also known as NPs, are quickly becoming popular as valuable providers and members of any healthcare team. They are highly educated and credentialed providers bringing unique expertise and personal experience to their patients' care and recovery. There are more than 300,000 NPs in the USA currently. Nurse practitioners are found in the primary care setting approximately 75% of the time. It's very common to actually see an NP in your primary care provider's office instead of seeing the medical doctor these days. And that goes for something as simple as a wellness checkup, all the way up to managing chronic diseases and treating flu and strep. Different state laws allow varying levels of autonomy for nurse practitioners. Here in Texas, the law allows nurse practitioners to manage their own patients under the oversight of a medical physician. And that means they can treat the patient right there and then in the clinic, or they can make a referral to a specialist for the patient when necessary. Just like when you go to your primary provider, the one you've grown up seeing your whole life. Same stuff. Now, here are some of the things a nurse practitioner does on a daily basis. They manage a patient's overall care and well-being. They prescribe medications and treatment when appropriate. They order imaging, lab work, and other diagnostic testing. They do a lot of patient education and counseling. They treat chronic and acute conditions, issues like infections, diabetes, injuries, and high blood pressure. And they educate patients on lifestyle decisions, preventative counseling, disease prevention, and all of their treatment options. So most NPs can be found in the primary care setting, as I said, but there are also specialty nurse practitioners. For example, some are in the surgical arena. Some are in oncology or are working in the OBGYN field. Our nurse practitioner here at Creekstone Integrated Medical spent 12 years in the cardiology field. Now, why is there a difference between medical doctors and nurse practitioners? Well, while it's true that nurse practitioners can do many of the things that a medical doctor can do, there are some key differences in the professions. The nurse practitioners are highly educated and extensively experienced. However, medical doctors do have more education. They have the MD, the medical doctor designation, behind their names. Therefore, they are regulated by the medical board in the state that they practice. Nurse practitioners, on the other hand, have 2 years more high-level education than a registered nurse has and are licensed by the nursing board in the state that they practice. The difference, though, goes far beyond what type of degree they have and their respective licensing boards. It's as much about the patient experience as it is anything else. Of course, there are amazing providers in each and every part of the healthcare field, but for the most part, nurse practitioners are very accessible and seem to be much more relationship-minded with regard to their patients than many of the other healthcare providers have a reputation for. Nurse practitioners tend to have a better bedside manner, if you will. They spend years as registered nurses taking care of patients before going back to school to get their nurse practitioner degrees. And for that reason, nurse practitioners will take time to get to know their patients and establish relationships with them. They are careful to include their patients in decision making and work together with the patients on a treatment plan going forward. And this is key. This is key to forming an effective team along with the patient. Nurse practitioners are commonly mentors, coaches, and cheerleaders for their patients while assisting them in managing or resolving health challenges and also helping them prevent future issues when possible through better lifestyle choices, all while costing less to the patient. Now, how educated is a nurse practitioner? Great question. Well, there are different levels of nursing. There are CNAs, which are certified nursing assistants. There are LVN LPNs, which stands for licensed vocational nurse or licensed practical nurse, same thing. Then there are registered nurses or RNs, and then there are nurse practitioners at the top. Nurse practitioners go through nursing school to achieve their RN degree, and from that point they must go back to school for another 2 years to get a master's or a doctorate in nursing. And that includes clinical training that is on a whole different level than their RN training provided them. The nurse practitioner's upper level coursework and training give them competency and specialized knowledge that is needed to allow them to work, function, and excel in all types of healthcare settings. Nurse practitioners offer a personal healthcare experience to their patients with more involvement and one-on-one personalization. Many times, most of the time, that means better patient care and better patient outcomes. At Creekstone Integrated Medical here, our nurse practitioner works with all types of patients to deal with runny noses, ear infections, hormone replacement and management, IV therapy, PRP injections, trigger point injections, medical weight loss, wellness plans, and so much more. So find out how you can get started here at Creekstone and have a truly customized provider experience that is tailored just for you. Call 806-355-3000 today. Schedule an appointment with our nurse practitioner here at Creekstone Integrated Medical. If you're watching on YouTube, subscribe, comment, and share, won't you? We sure would appreciate it. Same goes for Facebook. Until next week, take care. We'll see you then.